I think I'm going to start. Um, Welcome, everyone, and thank you for coming. My name is Simone Kremkau, and I'm a librarian at the Sonoma County History and Genealogy Library. I'm joined by my co-host and colleague, Joanna, who's helping to manage this webinar behind the scenes. Before we get started, this session will be recorded. It's actually recorded right now and will become available on the library's YouTube channel. Also, please mute yourself, turn your video off. The chat is open, and if you have any questions, we will have a Q&A session at the end of the presentation, and we will only take questions from the chat, so please feel free to submit them into the chat towards the end of the talk or whenever you feel you want to submit something. And last but not least, this library program is made possible by the library sales tax. So thank you. We are very excited to have Dr. Alexis Boutin with us today. Dr. Boutin is professor in the Department of Anthropology and coordinator of the Cultural Heritage and Resources Management Master's Program at Sonoma State University. Her research focuses on bioarchaeology, the study of human remains from archaeological sites. She received her PhD from the University of Pennsylvania in 2008 and has conducted fieldwork in the Middle East, United Kingdom, and California. In today's presentation, she will discuss how archival and archaeological methods are being used to reconstruct the biographies of residents buried at the Sonoma Developmental Center home cemetery during the early 20th century, a time characterized by a growing eugenics movement, as well as the 1918 to 1919 influenza pandemic. And I'm going to let you take it from here, Alexis, and stop sharing. And I'm also going to...
Okay. All right, so can you see my slides now? Hopefully. Okay. All right. Well, thank you so much, Simone and Joanna and everyone at the Sonoma County History and Genealogy Library for inviting me to present today. Simone in particular has been a great help in coordinating this talk. And I'm just grateful in general to Sonoma County Library System and the History and Genealogy Library for all the important services you provide to our community. And thanks to all of you who are watching today, especially since the topic of death, disability, and disease may not be the most relaxing way to spend your Saturday morning, but I hope it will be worth your while. So we're going to be today exploring a fascinating part of California's history that has surprising resonance with the present. But this does require me to discuss some topics and use some medical language, while historically accurate can be painful to hear. So I will try and let you know when that is coming up. So I know that just by looking at the attendance list that you have a wide range of experience with the Sonoma Developmental Center, or SDC, whereas some others of you may not be very familiar with it at all. I'll admit that I have lived in Sonoma County for the better part of 20 years, and I only really heard of it in passing due to its closure in 2018. It wasn't really put on my radar until 2022 when a colleague of mine from Sonoma State, Dr. Ben Smith, mentioned that debates over the redevelopment of the property were gearing up, and that a cemetery was involved, and that related to my professional expertise, which, as Simone mentioned, is in bioarchaeology, the analysis of human ancestral remains from archaeological settings, and mortuary archaeology, the archaeology of cemeteries and death. So here's an image of the SDC, which again, some of you may be very familiar with. These days, some of the most common reasons to visit are to take walks. It's a really lovely setting, a lot of flora and fauna. It's a wildlife corridor and some really striking historical architecture. So if you wanted to take a walk there these days, because of the recent transfer of the campus, you would have to park on Arnold Drive. And that would be kind of at the base of where this photograph was taken. And if you walked up the main avenue toward the brick administration building, you would start to realize that this building, which was constructed in 1908 after the Great Earthquake, was the hub of a 127-year history of this complex. And the SGC as a whole served thousands of residents in its existence. And today we would characterize those residents as being intellectually or developmentally disabled, physically disabled, mentally ill, and or behaving outside of social norms. So if you were taking this walk, you would walk past the brick administration building. And if you went to the left then, you might turn up Orchard Road. And as you continued up Orchard Road, kind of behind the main campus and slightly uphill, you'd see an oak woodland with grasses and some wildflowers, maybe some poison oak, depending on the season, set against the backdrop of the Sonoma Mountains. It's really lovely and peaceful. And you might notice this set of gates. But until recently, you probably would not have realized that this was a cemetery unless you looked closely at the existing commemorative signs. So one of these signs here is on one of the stone posts of the fence, and then there's kind of a rusted one that was erected in 2018. And even if you did see these signs to indicate to you that this was a cemetery, you may not have realized that beneath the ground lay buried the remains of more than 1,925 people who lived and died at the SDC across nearly 70 years between 1890 and 1960. And that's because shortly after the cemetery went out of use, its grave markers were removed, visibly erasing it from the landscape, except for this gate and low wall. So this visual absence was what spurred the Eldridge Cemetery Memorial Committee, a passionate group of SDC family members and former employees, to more visibly memorialize the people who were buried there. And their efforts were realized with the completion of the first large permanent memorial to name almost every former resident buried at the cemetery. And this memorial was formally dedicated in April 2024. And this image in the top left shows some of the community members and local politicians and staff members who were instrumental in that effort, although there were many more not shown here. So building on the existing efforts of these local community groups, our research team from Sonoma State aims to do a few things with our project. First, to help document and memorialize the SDC with a special focus on the cemetery, to improve the long-term management of the cultural resources and heritage that are represented there, and to understand the experiences of the people who lived there in life and in death by means of a combined life course and life history approach that is grounded in critical disability theory and disability justice. And we have a special focus now on the residents who survived and succumbed during the 1918-19 so-called Spanish influenza epidemic and lived with the consequences afterwards. So we're achieving all of these goals by using non-invasive archaeological methods, historical methods, and digital technologies, while always aiming to center the disabled people that society had pushed to the margins. So I'm going to go one by one and talk through each of these project goals, and then at the end share with you a couple of biographies of Sonoma County residents who lived at the SDC and are buried in the cemetery. So I want to start by talking about the community that we are working with. Again, we're trying to support their efforts to document and memorialize the SDC and the cemetery, which is often called the home cemetery. It gained that name when the residence was called the Sonoma State Home. So these are some of our community partners. We've been working with them since 2022. And these include stakeholders like the Eldridge Cemetery Memorial Committee, the Glen Ellyn Historical Society, multiple state agencies, so the Departments of General Services, Developmental Services, and Parks and Recreation, or state parks, as it's often known. And we've been supported by many different groups at Sonoma State, like the College of Humanities, Social Sciences, and the Arts, our Anthropological Studies Center, which you'll be hearing lots more about, the Northwest Information Center. And we've also had more than 30 students, undergraduate and graduate students, work on this project over the past few years. They come from a wide variety of personal and disciplinary backgrounds, and some of them themselves also identify as disabled, and they've been an instrumental part of this research project. So for those of you who aren't quite as familiar with the SDC, or those of you who want a little refresher, I'm going to provide some more context now about it. So in terms of where it's located, it is in the town of Eldridge, which is adjacent and just south of Glen Ellen, about a 25-minute drive from where I am now at Sonoma State University, going east over the mountains. It is located on the unceded ancestral land of the Wapo, Coast Miwok, and Southern Pomo, who today identify themselves as the Federated Indians of Great and Rancheria and the Michoa Wapo, respectively. The campus consists of nearly 1,000 acres, and it has a smaller core campus where the residences and office buildings and schools are. That's about 180 acres, with the rest consisting of open space. And so on this slide, if you look at the red arrows, you can see roughly where the cemetery is located in these larger landscapes. You can see it really just looks like kind of a tiny little dot on these maps. So as I mentioned, during its 127 years of operation, the SDC served thousands of residents from across the state. And by looking at how the names of the center changed over the years, you can see how its mission and the people it served, or more accurately, the way that society understood and pathologized the people with disabilities and behavioral differences that it served, changed over the years. In its first decades, residents were assessed upon admission with Henry Goddard's version of the Binet-Simon test. And this assigned them to levels of, I'm going to use some painful historical language here, assigned them to levels of feeble-mindedness, which today we would call intellectual or developmental disability, or maybe could also encompass behavioral differences. So they assigned them to these levels of feeble-mindedness, as well as high-grade or low-grade categories of each. And the image on the bottom right shows one depiction of how this was understood at that time in the first part of the 20th century. This was an era when disabling conditions and so-called degenerate social behavior were understood through the lens of eugenics. And eugenics was defined by the prominent American scholar Charles Davenport as, quote, the science of the improvement of the human race by better breeding, end quote. It should be noted that the SDC was a leader in the eugenics sterilization movement during the first half of the 20th century, as a number of historians have discussed in their very important research. And there were also other eras of, I would argue, medical malpractice at the SDC. Unfortunately, that's outside of the scope of today's presentation. We don't have enough time, but that is an important part of its history as well. That is deserving of further research. Between 1892 and 1939, more than 1,425 people were buried in what staff called the home cemetery in 47 rows. Their graves were marked in a variety of ways based on archival photos. So in this image on the top right, this is a map of the cemetery that was first created in 1958 and updated in 1969. And it shows the rows of the cemetery oriented from northeast to southwest. And this image is overlaid on a modern aerial photograph. On the bottom left here, this is an archival photo from 1941. And you can see that the grave markers range from painted wooden boards that bore the decedent's initials and their institutional registration numbers to very large, heavy poured concrete headstones with slightly more identification information. There's one of them barely visible in the back here, but we're going to see a closer look at those later. So after 1939, from 1940 to 1960, 500 sets of decedents' cremains, their cremated remains, were placed in a vault in the middle of the cemetery. Now, our preliminary estimates indicate that at least 118 of the people buried there would be considered people of color today. So Latino, Latina, Asian American, Indigenous Native American, or Black. And thus, they were probably subject to multiple types of marginalization based on their status as disabled people and people of color. And this number does not even include people of Jewish, Armenian, Greek, and other ancestries who also may have been excluded from spheres of Anglo-American privilege during their lives. So sometime after 1962, all of the grave markers were removed from the cemetery. Although we haven't been able to figure out exactly what led to this based on our oral history interviews and archival research that we've conducted. For about 50 years, as I mentioned, only a small plaque embedded in a stone gate at the entrance of the cemetery indicated that that was the purpose of this land. And again, this is where the plaque was embedded in that stone pillar. Only in 2024 was the permanent memorial unveiled. So the SDC closed in 2018 at the end of a long statewide process to move residents of all developmental centers into smaller community care homes. In 2023, a developer was selected to purchase the core campus and build hundreds of housing units, a hotel, and more, although this is currently held up in litigation. And in 2024, over 600 acres of so-called open space was transferred to California State Parks to become part of the adjacent Jack London State Historic Park. And so this acquisition is shown here in light blue that's going to be added on to Jack London State Park here in green. On June 30th, 2025, so about a little over 6 months ago, the last Department of Developmental Services staff vacated the campus in preparation for its sale. So the cemetery itself, again, you can see here with the red arrow where it's located. It's remaining for now under the purview of the state's Department of General Services, which is in charge of the real estate transaction. So the cemetery is both literally and figuratively located betwixt and between this privately owned land that's soon to be redeveloped and the publicly owned land that's been acquired by state parks. And although the cemetery itself has somewhat ironically been designated as open space, and it is not under the threat of development. There are no plans to develop the area of the cemetery. The rapidly changing nature of the campus surrounding it means that it's vital for the cemetery to be protected as a cultural resource and place of cultural heritage in this landscape. So this brings us to our second project goal, which is to improve the long-term management of the cultural resources and cultural heritage at the SDC. And again, we're doing this through historical methods, non-invasive archaeological methods, and digital technologies. So let's see some examples of this. So as I mentioned, over 30 students have been involved so far, and 2 entire classes of student researchers. They've done a lot of different things. This has included the descriptive analysis of artifacts. So on the bottom left, students Renee and Lydia are showing a shoe and a Pond's cold cream container that were recovered from a garbage dump dating to the early 20th century that shed light on some personal adornment and hygiene practices at that time. In the middle, we have, actually not there, on the bottom right, we have Ursula and Tristan, who did descriptive analysis of historical, administrative, and medical objects that told us a little bit more about how residents were evaluated, diagnosed, documented, and controlled. And specifically in that image on the bottom right, they are looking at the contents of one of the so-called intelligence or IQ tests that would have been administered there. In the middle, we have students Emily and Marina, and they were helping with archival research into bookkeeping ledgers, medical records, and death records. And they are shown here at the Sonoma State Library Special Collections, scanning payroll and cash flow ledgers from the late 19th and early 20th century. We've also partnered with Sonoma State's History Masters program to launch an oral history project with former SDC employees and community members. We started with 11 interviews last spring, and we are planning to continue this spring. And I know some of the people interviewed are on this Zoom, and I'm very grateful for their participation. So from them, we've learned about some of the experiences of the people who lived there and worked at the SDC over the past few decades, including their awareness of the cemetery and its history. One interviewee was a doctor who served some of the SDC's oldest residents, including one who came to live there after losing her family during the so-called Spanish influenza pandemic, which you'll hear more about in a bit. We've also conducted archaeological fieldwork at the cemetery. Now, I know that when people hear archaeology, they think about digging holes, but these days we have many more tools at our disposal that importantly are non-invasive, meaning we don't have to break any ground. We don't have to disturb the soil or any artifacts or any ancestral remains. And of course, this is a very sensitive environment, which is why we prioritize those non-invasive methods. So a team of Sonoma State faculty, staff, and students conducted 2 pedestrian surface surveys in 2023 and 24. So this was walking along the surface of the earth. These were led by Anthropological Studies Center staff member Samantha Dollinger, shown here, surrounded by poison oak and other wildflowers, and anthropology major Tristan Niles, who is shown here leading our metal detecting survey. And they were having to watch out for snakes at certain points of time in the beautiful spring weather. And these 2 played really key roles in leading the surveys and in subsequent reporting. So as a result of the 2 surveys, we found that 33 of the 47 rows of burials have at least one numbered concrete row marker surviving. So these row markers, there's one of them shown up here. These are about 9 to 10 inches on a side, and you can see they're sort of square-shaped, diamond-oriented. Put my hand down. They have imprinted on them the numbers of the rows. So there's one at the head of the row closest to Orchard Road, and there's one at the end of the row. And this map, which was created through GIS, a digital type of mapping platform, the yellow dots represent the row markers that were still visible. And you can see that quite a few of them, again, had some sort of marking visible, but some of them do not, due to different site formation processes and environmental changes. Significantly, for our research purposes, there was no evidence visible on the surface anyway for the location of rows 46 and 47, which I have just highlighted here in red. These rows were located across a small drainage from the cemetery proper, and even metal detectors were not able to find any sign of casket hardware in this area. Archival research and descriptive analysis of a small number of surviving grave markers from these rows suggests that they were almost exclusively used to bury victims of the Spanish influenza pandemic. So I'll come back to that shortly. Based on the results of the survey, the boundaries of the cemetery were expanded significantly to accommodate cultural resources that had not previously been accounted for. So if you look at the dotted line here on this image, that shows the previous boundary of the site that had been recorded in 2017 by a local environmental consulting firm. Our survey expanded those boundaries from about 1.3 acres to nearly 3 acres, so more than doubling the amount of area that's going to be protected from any future development. So it's that solid line that shows the new cemetery boundaries. So even given future land ownership or usage changes, these boundaries are now on file. They, along with the resulting technical report of this fieldwork, were submitted to the Northwest Information Center on Sonoma State's campus, which is part of the California Historic Resources Information System that manages all data about historic resources for the state. And that really supports the accessibility of this information to stakeholders and, again, any future developers. During the spring 2025 semester, 2 overlapping courses in archaeological technology were taught by anthropology faculty and ASC staff members Michael Konzak and Tom Whitley. This led undergraduate and graduate students to conduct a series of ground-penetrating radar surveys at the cemetery. And these preliminary studies focused on getting some sort of baseline data for the cemetery proper. That's what's showed in the image here. And then also trying to relocate rows 46 and 47 across the drainage. Although our long-term goal is to cover the entire cemetery. So you can see that the ground penetrating radar, it looks kind of like a baby jogger stroller with this radar box underneath. And it's sending signals down into the ground and then seeing how or whether they bounce back up. And so initial results of this survey did identify some potential grave shafts by breaks in the layering underneath the soil. So these images were prepared by Michael Konzak. This is from the historic map showing row 46, and we do see some differences in the layering of the soil consistency that could potentially be grave shafts. So we're going to be exploring that further in the coming weeks, actually, or months. As another exercise, students conducted a series of drone flights at the cemetery to create aerial images and digital elevation models to help with more accurate 3D mapping of the cemetery. These will help to model the surface of the slope of the cemetery and create base maps for, again, more accurate recording and representation. So these images show on the left kind of a pre-described flight plan on set transects around the cemetery, but also the way that Michael Konzak on the right is showing students, teaching them how to fly drones there for additional recording. This past spring, I also built an ArcGIS story map as part of our goal to improve the long-term management of the SDC's cultural resources and heritage. And this gave me the opportunity to pull together all of the data that I'd collected so far and to continue building on community efforts to commemorate the people buried there here in a digital manner. So this story map is a living digital interactive home for these archaeological and historical data that I'm hoping soon will be linked by a permanent QR code to the built memorial at the cemetery. In the meantime, I have taped up a laminated sign that I think has been seen by the public and actually was still there as of last week. So I designed this story map according to best practices for maximizing accessibility for all users, disabled and non-disabled. In providing historical context for SDC residents' lives and deaths, the story map explains that some contemporary practices of institutionalization and perceptions of disability did aim to improve the quality of life for disabled people and may have resulted in experiences of care and companionship and happiness. This image, which is on the story map, shows young women at Camp Butler, which was operated from 1932 to 42, and hosted some of these young women residents for outdoor activities and what they called nature craft. And I know that some of our community members are researching Camp Butler as well. But by contrast, other practices did prioritize the needs of non-disabled society, resulting in acts and words considered socially and medically acceptable at that time, but recognized today as harmful and dehumanizing. And although first-person accounts from residents are rare, I did do my best to include what I found. This is an example of a newsletter produced in 1953 called Echoes from the Valley of the Moon. And there's an article by a resident named Lee B. in that issue, and this image that was drawn on the cover as well. So we will continue adding to the story map until all 1,925 plus people buried there are commemorated with biographies. So if you scroll down to the bottom of the story map, and I do provide a QR code for it at the end of this presentation, you can also just Google it. At the bottom is this interactive cemetery map, where if you click on a row, a box will pop up telling you that row number. And if you click on the view button, you are presented with a list of people's names who are buried in that row, identified by their first name and the first initial of their last name. And if that name is hyperlinked, a biography has been written about it. We've got probably 50 biographies up so far, so we clearly have a long way to go, but we are working on that. I've got student assistants this semester joining the team for that purpose. And I've been so pleased that just in the last couple of months, I've been contacted by 4 people who found the story map and have asked for help learning more about their ancestors who are buried there, or as it turned out, may have been buried elsewhere. And that encourages me that it is serving its purpose of public outreach. So let's now turn to our other topic, the 1918-19 influenza pandemic. As I mentioned earlier, during the 2023 surface survey, we were shown 10 surviving grave markers in the storeroom at the SDC. So this provided some really kind of unexpected and interesting information. We compared these inscriptions on the grave markers with archival records, and we figured out that each one contained the institutional registration number, that 4-digit number at the top, the initials of the name of the decedent, and then their date of death. So we then cross-referenced that with a list of decedent names and archival evidence and determined that 8 of the 10 people whose grave markers had survived had died during the 1918-1919 Spanish influenza pandemic. And this is what brought us to a new research direction. And our third project goal, to understand the experiences of residents in life and death by means of a combined life course and life history approach that is grounded in critical disability theory and disability justice, with this special focus on the residents who both survived or succumbed to the influenza pandemic. And shown here is one of my great research teams who really helped me dive into this topic. And then on the right is me and my student Sabrina presenting at an international conference on this topic. So a little bit of background on the influenza pandemic. What is widely known today and at that time as the Spanish flu actually originated in North America. But since Spain, which was a non-combatant in World War I, was one of the only countries to make their influenza data public, the pandemic got inaccurately labeled the Spanish influenza. Recent estimates place the global death impact of the influenza pandemic at about 17 million people. By comparison, the COVID-19 pandemic has killed more than 7 million people since 2020. So about 2.5 times as many people died of the influenza pandemic. It's widely recognized as having occurred in 3 distinct waves, with the second wave in fall 2018 featuring the highest mortality rates. The extreme mortality of young adults compared to other demographic groups is one of this pandemic's most striking features. At the SDC, as we will learn, 88 residents and 1 employee died. They averaged 23 years of age, so again, consistent with that young adult pattern. And almost all of them died during the second wave. In Sonoma County as a whole, 175 people died of influenza. This means that deaths at the SDC accounted for just over half of all county deaths. Scholars have recently focused on how people who lived in institutions, due to intersecting factors of disability, social race, and poverty, suffered higher mortality rates than non-institutionalized populations during the influenza pandemic. So to better understand the effects of influenza at the SDC, we're drawing on a variety of historical sources, undertaking both qualitative and quantitative data collection and analysis. And all of our efforts are shaped by engagement with critical disability theory and disability justice literature. So critical disability theorists come from a variety of disciplines, and they offer approaches to understanding the intersectionality of identities. As I mentioned, social race, poverty, gender, along with disability, and how these can be subject to oppression in ableist and capitalist Western societies. Disability justice advocate Sandy Ho and the Harriet Tubman Collective lay claim to taking up space in the world as disabled people, and especially as disabled people of color. They specifically point to the importance of publicly naming disabled people of color whose deaths were caused or hastened by the societies and institutions that pathologize their disabilities. Ricardo Thornton Sr. describes how institutions stripped him of agency by having low expectations for residents and encouraging dependency rather than growth. Now living independently, Thornton pushes back, saying, quote, "What I've seen is that when people are given a chance to grow and contribute, they grow and contribute. Having an intellectual disability doesn't limit what you can contribute," end quote. He's one of many in the disability justice community to advocate for agency and self-determination. Finally, Kia Brown points out the importance of acknowledging disabled joy. Our society too often associates disability only with sadness and shame, but disabled joy exists and can be a pathway to hope and freedom. So now I'm going to turn to some of the results of our archival research. And I do want to let you know that this is where I will be using some historical terms that can be painful today in relation to intellectually and developmentally disabled people. So we've been able to conduct some analyses that are quantitative in nature at the level of the institution. So the California State Commission in Lunacy, as it was called in the early 20th century, had its staff produce biennial reports every 2 fiscal years, where institutional directors and staff described their budget and operations and the residents who lived there. So by looking at the ones for the SDC from 1902 to 1920, we can focus on the time frame during which most of the residents who died during the influenza pandemic were admitted to the institution. So this chart on the left is showing what was called by the institution the assigned cause of mental defect, so the reason for their admission. So my research assistants and I divided these, we sort of coded these by categories that we identified, and those are visible on the right. You can see that the one called familial related condition in light blue is very high. So this would include where they identified the cause as being congenital, or they would list the intemperance or alcoholism of the father, or what they called the neurasthenia or anxiety of the mother. Mothers get blamed a lot, let me tell you, for this. Infectious diseases were also a common cause. So syphilis, measles, meningitis. Neurological conditions shown here in orange were also quite common, with epilepsy being the most common of those. And you can see here that this very high proportion of familial related conditions is consistent with the increasingly prevalent eugenic belief of that time, of the hereditary nature of feeble-mindedness. We've also looked a lot at contemporary newspapers. So they tell us a lot about how the pandemic proceeded through Sonoma County. We learned that the first influenza cases arrived during the second wave of the pandemic on October 13th, 1918, when cases were reported at a highway construction camp. By 2 days later, 75 cases of influenza had been reported at another institution, the Lytton Orphanage, now up in Geyserville area. And its first victim, Helen, died shortly thereafter. There were also some new cases in Santa Rosa, and after that, influenza just spread all over the county very rapidly. At the SDC, 24 residents and 1 attendant had died by November 6th. One update noted that the so-called strong or high-grade residents were disproportionately struck by influenza. And by high grade, that means those whose assigned disabilities were less severe. There are also hints, which my student Ursula identified, of some infection management protocols that the SDC practiced, such as ward-specific quarantining, masking, and newspaper interviews conducted by telephone, which were sort of the COVID-style social distancing of its time. This article from the Press Democrat refers to masks being torn off the SDC at the end of the second wave of the pandemic in early December 1918. But Sonoma County was then struck in early 1919 by the third wave of the pandemic, although it died down by the end of January and schools reopened in early February. The SDC experienced the same flare-up, although the Petaluma Argus-Courier reported that these cases were diminishing by February 4th. So while we analyze these newspaper records, we bear in mind critical disability theory's emphasis on the social and discursive constructedness of disability. We really clearly see here the ways in which physical and cognitive differences were categorized and often pathologized through language and practices, and how this would have shaped the experiences of the SDC residents. Looking at the SDC's internal records reveals a more nuanced story of the pandemic's effects at the institution. We learned that it arrived there on October 24th or 25th, when 6 assigned male residents were afflicted. The first to die were Herman H., who was a native of Shellville, just south of Sonoma, and Frank M., aged 21, on November 1st. The lone staff member to succumb, an attendant named Daisy Marquis, died on November 5th. And interestingly, it appears that hers was the only death certificate to be signed by the superintendent of the SDC, Dr. Frederick Butler, rather than by a staff physician. The last resident to die during the second wave was Ralph F. on November 27th. As just mentioned, the third wave also struck the SDC in early 1919 in the form of a flare-up at its tuberculosis hospital. Emma S., a native of Colorado, was the only resident to die then on February 5th. So she was the last victim of the Spanish influenza pandemic there. Overall, 483, or 35% of the home's residents, were sickened by influenza during this pandemic. And as mentioned earlier, 88 residents died, all during November 1918, except for 1. This means that the mortality rate of 6.4% far outpaced that of the county as a whole, whose mortality rate was less than half of 1 percentage point. It should also be noted that variants of the 1918 H1N1 influenza virus continued to circulate, as they still do up to the present day. We're in flu season right now, with seasonal surges that occasionally rose to the epidemic or pandemic level. For example, 2 more SDC residents died during the February 1920 seasonal epidemic. And in March 1922, influenza was listed as either the primary or secondary cause of death for an additional 12 SDC residents. So let's look a little bit more in a qualitative manner at what life was like during the pandemic at the SDC. So in anticipation of the pandemic's arrival, as of October 15th, all residents' outgoing letters to friends and relatives advised them not to visit the SDC. Like all other large state hospitals at the time, the SDC was over capacity. According to the biennial report, in addition to its occupied beds, 41 patients slept in hall rooms and day rooms, and 34 more patients were overcrowded in rooms and dormitories. During the throes of the second wave, Superintendent Frederick Butler reported that, quote, school was closed, church, Sunday school, and all forms of amusement were discontinued. Various wards and private rooms of employees were fumigated, and as strict a quarantine as possible was maintained, end quote. The existing policy of segregating assigned males and females was carried over into quarantining practices. For females, the recently completed Walnut Cottage, shown below, was used for that purpose of quarantine. Interestingly, it had been constructed to house, quote, delinquent, feeble-minded females from around the Army and Navy camps as a protection to the enlisted men, end quote, of World War I. And the protection is inferred to be from venereal disease or sexually transmitted infections. But the repurposing of this cottage for quarantine, in fact, may have helped save the lives of these women. In fact, the mortality rate for assigned females was only 2.1%, a fraction of that of men at 10%. On December 8th, memorial services for the large number of residents who passed away during the previous month were officiated by 2 local reverends in the Assembly Hall, and all residents were invited to this service. So if we look at these deaths, the number of deaths, and the places of burial on a bi-monthly basis between 1916 and 1922, the dates for which we have good evidence, we see that an average of 12 residents died every 2 months at the SDC. During this time frame, an average of 60% of the residents were buried in the home cemetery, so that's shown in blue, while about 40% were claimed by family and buried closer to home. By contrast, in November 1918, which is shown by this huge spike here, 89 residents died in 1 month, all but 2 of influenza, which would have stretched the institution's capacity really thin, especially since 80% of them were buried in the home cemetery, while only 20% were shipped home. It should also be noted that there are uncertainties or changes in the burial location for 7 of these residents during the pandemic, far more than usual, again, pointing to a strain on institutional resources. This also means that at least 3 residents whose names should be on the memorial, the permanent memorial, are not. Now, death was not an uncommon occurrence at the SDC. It had its own morgue and chapel. You can see on the bottom left, this is a photo from the 1930s. It's had its own hearse. And residents and staff were regularly involved in carpentry and painting. They built coffins and grave markers, and shrouds were made in the sewing department. But during the pandemic, SDC business manager Sutton Field reported that carpenters spent 3.5 days, apparently far more time than usual, making coffins, while painters created a mask sign. He also notes that the work of ploughing and seeding was slowed down because of having to take the farmhands, presumably residents, to dig graves during the epidemic. So it seems like residents themselves were not only making the grave markers, but also helping to bury their fellow residents. Through November 8th, influenza victims were mostly buried in the rows shown in red here on the map, rows 24 and 25, and rows 40 through 43. But on November 9th, a new area for burials was opened up on the far side of the creek. These 2 rows would eventually be numbered 46 and 47, and 15 of the 18 people buried there are victims of the 1918-19 influenza pandemic. When the grave markers were removed from the home cemetery more than 40 years later, several of those from this area were preserved and kept in the storeroom, which then led to us viewing them in 2023. So now moving on to our biographies. As I mentioned, we're creating biographical sketches of each resident buried in the cemetery. For the influenza victims, we're using this life course, life history approach. And by that, I mean that we're looking at how their early life health status, the diseases they'd suffered, the vaccinations they may or may not have received, as well as their socioeconomic conditions growing up, may have been linked to their outcomes during the influenza pandemic, whether they survived or succumbed. Also looking at other aspects of their historically situated and intersectional identities as disabled people. So I'm going to wrap up now by sharing biographies of 2 SDC residents who were natives of Sonoma County and who died during the pandemic and are still buried at the SDC cemetery. So we'll start with Frank B. Frank was born in April 1900, the 3rd son of immigrants from Italy. By 1910, 5 daughters had been added to their family, although Frank's older brothers had passed away. A 1908 newspaper advertisement for the Lombardo Hotel, with Frank's father as one of the proprietors, suggests that the family was living in Sonoma by that time. In June 1910, a local doctor applied for 10-year-old Frank to be admitted to the SDC, about 7 miles away from the family's home. Once there, he was diagnosed with an intellectual or developmental disability. Apparently, this family had recognized his condition when he was 3 years old, and he had not received any formal education, unlike his sisters. During the 8 years that Frank lived at the SDC, many opportunities existed for education and enrichment of young people, including school, music, gymnastics, shown here, and handicrafts, which seemed to be aimed at intellectual and motor development. He also may have enjoyed attending the Christmas play, the 4th of July celebrations, and even the minstrel shows that were staged every year. At age 18, Frank died of Spanish influenza and bronchopneumonia in November 1918, during the first week of deaths caused by the pandemic. He was buried in row 41. Frank's grave marker still exists and is curated by the Glen Ellen Historical Society. I was contacted in 2024 through Ancestry.com by the wife of Frank's grandnephew. Her husband hadn't known that his grandmother had had any brothers, despite being close to that side of the family. Based on the information I shared, Frank has now been added to their family tree. The other resident I want to tell you about is LGC. LG was born in 1890 in Ukiah, the 3rd of his parents' 4 children and their only son. His father was a native of a gold rush town in the Sierra Nevadas, and his mother was a native of Utah Territory. Their social race was white. As an infant, LG survived cerebrospinal meningitis, although it seems to have left him with an intellectual disability and absent or impaired speech, which are all documented neurological sequelae or effects of meningitis. Unlike his sisters, LG did not attend school. By 1900, when LG was 10, the family had moved to Santa Rosa. Unfortunately, his mother died that same year. In Santa Rosa, his father worked in the laundry trade. He remarried in 1906, and 2 years after that, he applied for LG to live at the SDC. It may or may not be a coincidence that LG's oldest sister got married and moved to Yuba City at this time, taking their youngest sister with her. LG was admitted to the SDC when he was 17 years old. Of medium height and build, he had brown eyes and dark brown hair. He lived there for 10 years, from 1908 to 1918. Unlike some of the other occupations, the other residents, he held no occupation there. LG died of Spanish influenza exacerbated by bronchopneumonia at the age of 28 on November 6th, the same day as Frank B. And like Frank, he was buried in row 41. LG's father continued to live in Santa Rosa until his death in 1937. He, along with LG's maternal grandparents, are buried in the Stanley section of the Santa Rosa Rural Cemetery. Like LG, none of their headstones survive today. So our research is continuing. I have 3 master's students in the Cultural Heritage and Resources Management program who are organizing their thesis or project to complete the program around the SDC. For example, we are beginning to develop a digital special collection devoted to the SDC to be housed at the Sonoma State Library. It will include copies of archival photos, documents, architectural plans, and material culture inventories that other researchers can access, as well as the transcripts of the oral history interviews. Many of these materials have been shared by the Department of Developmental Services and the Glen Ellyn Historical Society, for which we are very grateful. And so this will be Sonoma County native Sally Kelly's culminating project. Caleb Riley will investigate the biological and social factors that shaped survivorship and mortality patterns at the SDC during the influenza pandemic. Specifically, he will explore whether health outcomes were correlated with age, gender, race, severity of disability, and health history prior to admission. And here we're working with University of Colorado Boulder and Sonoma State alumna, Dr. Sharon DeWitt, who specializes in paleoepidemiology. And Blake Bogert will build on the pilot project of ground penetrating radar at the home cemetery to obtain full survey coverage of all 47 rows in partnership with Sonoma State's Anthropological Study Center. His data analysis will shed light on the accuracy of historical records for burial numbers and locations and suggest what other social and environmental factors may be affecting preservation at the cemetery. So, why does this intersection between disability, disease, and death from over 100 years ago matter today? Well, during the first year of the COVID-19 pandemic, the mortality burden was greater for intellectually and developmentally disabled people than for people without these disabilities. However, the lack of adequate public health data for these people, intellectually and developmentally disabled people in the US, means that it's really difficult to accurately assess the full consequences of this infectious disease pandemic on vulnerable populations. And this data inequity was actually pointed out back in 2024, before the current federal administration. It's also crucial to be mindful of the fact that infectious diseases themselves can have lifelong disabling effects or sequelae. Long COVID is one that's very well known these days, but also measles, which can cause encephalitis and intellectual disability. Polio can cause paralysis and nerve damage. Congenital rubella can cause blindness and deafness, etc. So again, the current stance of the Department of Health and Human Services, which is questioning the safety and efficacy of routine vaccinations against infectious disease, is quite likely to cause the proportion of disabled people in the American population to grow. This is exemplified by the CDC's decision this month to remove many vaccines from the list of those recommended for all children, including the one for meningitis, the disease that disabled LGC. A move that the American Academy of Pediatrics says is, quote, dangerous and unnecessary, end quote. Now, I do want to be clear that while having more disabled people in the American community is, in and of itself, by no means an undesirable outcome, the lack of adequate funding for medical and support services, which has become even less adequate over the past year, most certainly is an undesirable outcome. So, to conclude, legal scholar Louise Harman writes that, quote, cemeteries often become abandoned or forgotten when the land use becomes oddly out of context with the surrounding area for a variety of reasons, end quote. Given that the Department of General Services, which typically manages real estate transactions, not cemeteries, has now assumed responsibility for maintaining the cemetery and its memorials, the risk for the home cemetery is real. Although during my visits, as recently as last week, shown here, it appears to be continuing to receive good care. On the other hand, preserving and restoring institutional cemeteries, Harman says, quote, sends a message that people with disabilities are valued members of the human family, end quote. Queer disability activist Stacey Park Milburn, herself now an ancestor, acknowledges that many disabled people live short lives and may not have direct descendants. So based on the vernacular definition of ancestor, as based on lineal descent, many people at the home cemetery may not be considered ancestors. And we know that at least part of the reason that residents were buried in the home cemetery was because their family was not willing, or just as importantly, not able to claim their remains. Although based on the descendants I've spoken with recently, many of them simply did not know where their ancestors were buried because their families hadn't spoken about them or hadn't received information about them from the institution. But Milburn's words emphasize agency. She writes, quote, a crypt understanding of ancestorship holds that our deepest relationships are with people we choose to be connected to and honor day after day. Ancestorship, like love, is expansive and breaks man-made boundaries cast upon it, end quote. So through the collective efforts of our research team at Sonoma State and local stakeholders, we honor the people buried in the home cemetery as ancestors, documenting, protecting, and interpreting this place of permanent rest through landscape, material culture, and archives, and saying the names of the people buried there so that their lives and deaths will not be forgotten. So I'd like to thank many, many people who are listed here by name for their incredible support of this research, financial, logistical, emotional, etc. And I also, on the next slide, I'm going to put up my email address and 2 QR codes. So one of them on the left has a list of all the references that were referred to in this presentation. And on the right is the QR code so that you can visit the story map and hopefully explore it and learn from it. So my email address is here. I'm more than happy to take questions now, but also feel free to reach out to me if you want to talk further, ask more questions, or maybe even be involved in the oral history interviews. Thank you very much.
Oh, thank you, Alexis. This was really very informative, very detailed. I'm so glad we're recording this. I feel I want to go back and just review a few sections of it. And I'm also very excited that your findings will be shared digitally through through SSU's library, so we can all find out more about it. Thank you. So I'm already seeing. Ooh, I'm just seeing questions here. Let me just go to the first one. So the question is, who gets markers, quote unquote, on the other side of the street from the home cemetery?
So as part of the permanent memorial installation in 2024, the Eldred Cemetery Memorial Committee also put in an installation that features part of the Eldridge Portraits Project. These were portraits that were taken by former staff member Christian Pease, along with other former staff members of some of the last residents of the SDC and their family, whether biological or chosen. There also have been put in place there some of the memorial markers that used to be around the campus, but were removed after it was closed. So that part of the installation is more related to the more recent history across of the SDC. And it's a great place for people to visit if they're interested in learning about the recent history and continues to pay tribute to these residents. That being said, it is not part of our research project on those who are no longer, commemorated more as visibly. And again, we're focusing on the history up to 1960 of the institution and the people buried there, at least as far as the cemetery is concerned. But it's a great place to visit.
Okay. Another question here, it's a little longer one. Could you discuss the responsibility of an institutions to manage the results of the normal sexual needs and actions of a variety of intellectual levels in individuals who were housed at SDC relative to the use of sterilization as a form of birth control?
Okay, so that is a great question, and I I am not unfortunately equipped to answer that question given my area of expertise, and given the fact that there is an enormous amount of really excellent literature out there on this topic. Um, I would recommend that you look at the references I listed. Some of the scholars who've been really involved in this topic are people like Alexandra Minna-Stern, um, um, I'm forgetting some of the names, but there are some really great references on this. Jess Whatcott is a professor from San Diego State who has also looked at kind of a queer history of the carceral eugenics at these institutions. So there's excellent scholarship out there, and I do not claim to be an expert on this. So I would really defer to those experts for these purposes. And I will also say that if people want to access some of the resources and I have difficulty with that, I'm happy to share copies that I have.
That's great. Another question here, where would the cremains have been buried, kept? And is there any movement in looking into those remains?
Yeah. So it's really interesting. I one of my research assistants, Wyatt, I asked him to do some archival research on why did they switch to cremains, and we couldn't find anything in at least in newspaper archives, and not yet in institutional archives. My guess is that they were sort of running out of room for interment burials at that time. There was even actually talk around the late 1930s of just closing the cemetery altogether. My guess is that they realized that they had remains of decedents that were not going to be claimed by family, and they needed to do something respectful with them, which is why they had the cremations conducted. Interestingly, the decedents' remains were, looks like, sent to the Napa State Hospital for cremation and then brought back to the SDC. They were then interred in a vault in the cemetery. It's kind of in the middle of the cemetery. It's sort of visible on the map that's in the story map. And this vault was refurbished in I believe, the 1990s or early 2000s. It's still visible today. It's kind of a big concrete pad, very highly visible. And our project is absolutely looking into the people whose cremains are buried there. They're just as sort of important as those who were buried. So on the story map, there is I believe it's a dot on the cremains vault. And if you click on that, or maybe actually it might be a polygon, a square on the cremains vault. If you click on that, you get a list of all the decedents whose cremains are there. And you can start to read the biographies of them too.
I'm just replying to a question myself here.
Oh,
This is a moment. What field you are in? If you just want to tell
sure.
somebody who
Yeah.
joined later who you are, maybe real
Yeah, no, that's good because I mentioned my areas of expertise. Just as a
good.
reminder, I have my PhD in anthropology. I specialize in archaeology and biological anthropology, specifically the analysis of human ancestral remains from archaeological settings, and the archaeology of cemeteries and the people buried there. My undergraduate degree is actually in history, so it's really fun to get to go back to the archival research with this project. And I'm a professor of anthropology at Sonoma State.
Thank you. Do we know where the many employees who were buried,
Mm.
do we know where the many employees who were buried in the home cemetery are, I think?
Yeah. So it's really
are
interesting.
buried.
Yeah. Only two employees were buried there, as far as we know. Interestingly, maybe not surprisingly, the circumstances of their burial were given a little bit more attention in the archival records. I see that the next question is about the nature of those archival records, so I'll just preview one of them. In
Yes.
1958, with the impending closure of the cemetery, the mortician at that time, named Percy Miller, made a list of the names of all the people buried there and the row that they were buried in. Now, we don't know exactly where in the row each one was buried, but we know the row they were buried in. That's why on the story map, if you click on the row, I've simply listed the names alphabetically. Only two employees were buried. And let's see, I'm trying to remember which row they were buried in. I can't remember off the top of my head. I believe it, okay, email me if you really want to know. But they were two employees who, from what I could tell, had moved out to California on their own and did not have families in the area. We have written biographies, I think of one, if not both of them. And they were, older male employees, didn't have family, had worked at the SDC for a very long time, and probably lived there as well as employees. So they were buried there with the other residents who were considered patients at that time. But they are the only two to be buried there.
Mhm. Next question pertains to historical records. As you said, Steve is interested in the historical records you were using to document the burials, burial
Mm-hmm.
registers, case files, etc.
Mm-hmm.
And where are these now housed and preserved? That hits home a bit. Given the privacy laws now in place, how are you or how were you accessing these records?
Mm-hmm. Yeah, that's a great question. So, these archival records, some of them are in the Sonoma County archives, which the Sonoma County History and Genealogy Library helps researchers to gain access to, if appropriate. A lot of them are in the California State Archives. Now, part of this relates to HIPAA, the patient privacy laws, and
Mhm.
which of these records are subject to HIPAA. HIPAA only came into place in the 1990s, and it only covers certain types of institutions. I have engaged extensively with the literature on the ethics of biohistorical research and medical historical research. Um, a lot of the records that we have access to are already published on ancestry.com and on Internet Archive. They were not put there by me. They were put there by earlier researchers. Before I created the story map, I talked to the Department of Developmental Services staff and I got their permission to make it and make this information more publicly available. However, this also shaped the kind of naming practice that we use, which you probably noticed, which is the patient's first name and the first initial of their last name. And that's kind of trying to strike a balance between humanizing these residents because they have been dehumanized by their past treatment by giving them their first names, but not disclosing their last names. So in case there are any concerns about, descendants' medical history, the stigma that continues to surround disability. Even the SDC itself, in that newsletter I shared, the current residents were named by their first name and their first initial of their last name. So that's the practice that we've used in our project to try and respect privacy laws that exist now, even if they don't fully apply to all these types of records, but also to try to restore these people to kind of the historical memory of Sonoma County and the broader community. Oh, and then the historical records we're using a lot of different kinds. So, the lists of burials, the medical records of the decedents, which are only available up to about 1920, application records, death records, some of the internal records, so meetings from the boards of managers at the SDC, the payroll ledgers, lots of different types of archives.
Okay, I hope this answers the question we have here, and I'm going to say the name, Patricia Cullinan, Sonoma Valley Historical Society. I would
Great.
like to do an oral history for SDC.
Excellent. Patricia, I will probably not remember that. So if you could email me, I would really appreciate it. But I would love that. We'll put you on the list.
And I'm saying the next name too. This is Jeremy Nichols. The state of California legalized cremation for indigents in 1943. I don't know if the home residents would have been considered indigent under the law.
Yeah, hi, Jeremy. That's a great point. And I know that that's something you've encountered in your research as well. I don't know either. That's something we could look into. But I would imagine that the failure or inability of families to claim those remains, um, would have contributed to some sort of label of indigency being applied here, whether even if it was just in a de facto way.
We have a participant writing, OMG, anthropology is so cool.
I agree.
And someone else, I was gobsmacked, quote unquote, when I first came upon the memorial, as I was shocked records were kept of the 1,925 buried there. How difficult was it to gather this info?
Yeah. Well, again, the Eldridge Cemetery Memorial Committee, they were the ones who made this initial list that was put on the memorial. They looked at that 1958 list that was compiled by the mortician, and they checked it against other types of records. So they are the ones who did a lot of that really hard work. Kathy Spees was one of the main people involved in that during the COVID-19 pandemic. So what we've done is kind of further fact checking of those names, and we've used a lot of the records of the types I just mentioned. There are a lot of misspellings in the archives. In fact, one of the family members who's contacted me, part of the reason she couldn't find her record of her ancestors because there was an additional letter added to his name in the institutional records. So it was actually great to have that resolved so we could better connect. Those folks. Am I frozen? No? Okay.
No, you're good. So we
Okay.
have somebody who lost sound. Did everybody lose sound? Is it just one person? Don't wanna. There's nothing wrong.
Okay.
Sound is okay. Okay, thank
Okay.
you.
So yeah, I'll continue
I
then.
can hear you. Sound is good. Thanks. Thank
Thank
you.
you.
I
Um,
yeah.
yeah. So just to say that I think, I mentioned that we're making use of the publicly available records, the ones on ancestry.com and in Internet Archive. There are other types of records, including sterilization records, that are not publicly accessible. You do have to go through an institutional research board that considers the ethics of your approach and considers the protections that are needed in order to get access to custodial hearings, to sterilization records. And right now, that's not what our project is focused on as much. We're seeing what we can do at kind of a larger scale to restore stories to some of these almost 2,000 people. So that has been a little bit easier, but I know there are other researchers, as I mentioned, who have been kind of going through those other bureaucratic measures to get access to other types of records. But it is really important, to recognize that some of these institutions did enact a form of violence on their residents when they kind of erased their identities or, conferred mistakes upon their identities in these archives.
Hey, I hope I got all of. Oh, here's one more.
Oh,
You mentioned the location is a nice place to walk. Is it open to the public?
yeah. Hi, Shauna. It is, although you have to park on Arnold Drive and walk in these days. Unless you have some sort of access. There are some local community groups that like run a ropes course up at the old Camp Via behind the cemetery, but most people just walk around it or bike. I often see people walking by the cemetery along Orchard Road, which is wonderful. It's beautiful. But I will also say from a disability justice perspective, it's concerning to me that it's no longer possible for people to drive up to the cemetery, given that the memorial does have a spot for people with disabilities set aside. For people with mobility impairments, it's now much harder to tour the campus and access the cemetery. So that is a concern I have about the current kind of administration and management of it. But I also recognize that there are a lot of, logistical barriers given the current sort of state of limbo of who's taking care of the property.
Here's a question about the pool. Do you know when and why they decided to cement the pool? Was that later on or was it earlier during its operation?
You know, I know the pool that's being referred to here, it's on the east side of the campus, and I honestly have no idea about it. I think a lot of those buildings were constructed in the second half of the 20th century, but I don't know at what point the pool was cemented in. The Department of Developmental Services facility staff would probably know that.
Okay, I think, are you still okay with taking questions?
Yeah, I'll take
It's
Julia's question. Yeah.
okay, so we have one more maybe.
Okay.
Were most of the causes of death of residents natural, or was there any mistreatment that led to death?
That's a great question, Julia. It's interesting the manners of death that we use these days, natural, accidental, homicide, suicide, unknown. Because there's so many systemic social and environmental factors that led to the overall health outcomes of these people. It's hard to just label it one of those things. I would say that most of the people there, of what we've seen so far, died of like infectious disease. They died of epilepsy that was not controlled adequately. So I think that a lot of those causes of death would be called natural these days. That being said, there were sometimes accidental causes of death or traumatic causes of death. And it's hard to tell sometimes whether those were intentional or accidental. So I know some people died when they ran away and they drowned, or they were in a vehicular accident. I know that there were instances where people died because they were burned while they were working, or they fell into a heater, things like that. It depends on what we mean by mistreatment, right? Was it intentional acts of violence, or was it still an act of violence that was maybe part of a larger institutional system, but was less kind of overtly traumatic? So that's something that could probably be explored further, Julia. Julia's my student.
Thanks to all the students
Yeah,
joining.
yeah, it's so great.
We had 78 registrants with this, which is unknown for a public library. So thank you.
Yeah, thank you.
I think we are at the end of the list of questions. And yeah, I want to say thank you again for the presentation. It was detailed, it was thorough, insightful, and thank you for everyone attending. If you enjoyed this event, you can find a full list of upcoming events at sonomalibrary.org/events. And I hope you all have a wonderful rest of your day and weekend. Thank you.
Thanks so much again, Simone, and everyone for coming. I appreciate
Thank
it.
you.